Hello, everyone, and welcome to the TMA Ask the Expert podcast series. Today's session is entitled Alternative Therapies and Lifestyle Management After TM, NMO, and ADEM. My name is Roberta Pesce, and I'm the Research and Project Manager at the Transverse Myelitis Association. We are a nonprofit focused on support, education, and research of rare neuroimmune diseases. You can learn more about us on our website at myelitis.org. We're pleased that Sam Hughes from UT Southwestern Dallas, Texas is joining us as our guest moderator for today. Before I turn it over to Sam, a few housekeeping pieces. This podcast is being recorded and will be made available on the TMA website at myelitis.org. During the call, if you have any additional questions, please send them to us via our Facebook page at facebook.com/myelitis. Sam, could you start us off by introducing the speakers?
Great. Thanks, Roberta. I can do that. I do want to give a little disclaimer to all of our listeners today. I'm feeling a little under the weather, got a little cold coming on, so if you hear any sniffles or muffled coughs, that's just me. Don't worry about it. So I apologize in advance. But back to our podcast. I'm honored to be guest hosting this podcast today, and I'm pleased to be joined by Dr. Scott Newsom, Paula Hardiman, and Catherine Treadaway. Dr. Scott Newsom specializes in the care of patients with neuroimmunologic and neuroinflammatory disorders of the central nervous system. He has special interest in evaluating and treating patients with multiple sclerosis, transverse myelitis, neuromyelitis optica, and stiff person syndrome. Dr. Newsom works with the Division of Neuroimmunology and Neuroinfectious Diseases at Johns Hopkins Hospital. He joined the Johns Hopkins Multiple Sclerosis and Transverse Myelitis Centers after completing fellowship, and he is currently the director of the Johns Hopkins Neurology Outpatient Services and the Neurology Infusion Center. Paula Hardiman is one of the physician assistants in the neuroimmunology program at UT Southwestern Medical Center. After completing PA school, she worked in a primary care and internal medicine office where she was able to implement many programs to help patients learn about and better manage their chronic diseases such as diabetes, high blood pressure, and asthma. In February 2010, Paula joined the neuroimmunology program at UT Southwestern. And not only is she involved in the evaluation and treatment of patients with demyelinating disorders, but she also develops and coordinates various research projects and health and wellness programs. Catherine Treadaway received her bachelor's degree in sociology and Master of Social Work at Louisiana State University and has been at the Multiple Sclerosis program at UT Southwestern since September 2002. She works with a dynamic multidisciplinary team in the MS Clinic and the Pediatric Demyelinating Disease Clinic, participating in research and patient care. She assists patients by serving as their advocate, locating resources, providing counseling, support, and information, and arranging home and outpatient care. She also assisted in the development of the Total Life Care Clinic, a clinic within the Multiple Sclerosis Clinic, as well as participates in this weekly multidisciplinary clinic for at-risk patients. Thank you to all of our experts for joining us today. And a thank you to all of the listeners for joining us and sending us your questions in advance. I will do my best to get through as many questions as we can today. So to start out, getting the ball rolling, it looks like the questions mainly fell into three basic categories. Questions about diet and alternative diets or special diets that could help with these kinds of diseases. And then questions regarding more issues with spasticity and movement, and then also work-life balance kind of questions. So we're going to start out talking about diet for the first part of the podcast. And so the first question, and this comes up a lot, I'll direct to Paula first. Is there any evidence or indication that gluten-free and or dairy-free diets affect symptoms?
Well, I guess the way I'll start answering this question is with the first part. Is there any evidence or indication? So if you take it from that stance, no, there's no true evidence or indications that our patients should go on a gluten-free or dairy-free diet unless they have documented a true lactose intolerance or have celiac disease. But what I think a gluten-free, in particular a gluten-free diet, if a patient chooses to follow that, what that causes you to do is to start introducing in more fresh fruits and vegetables in the diet. And so from just a good nutrition standpoint, there's a lot of benefits from vegetables in particular and fruits that our bodies need. And so if you're eating the traditional American diet of meat and potatoes, you're missing those key micronutrients that we all need to get. So I do have patients who do what I'll say a gluten-light diet. They don't go completely gluten-free, and they do report an improvement in their symptoms, primarily fatigue, cognitive effects, and some bowel symptoms, especially if they have a lot of constipation or gas and bloating, seem to improve when they go on a more gluten-light diet.
And on that note, and Dr. Newsom, you might can chime in with this. In light of what Paula just said, are there any recommendations for a specific kind of diet or things to avoid that are more specific to transverse myelitis, or kind of the issue with these neurological deficits that could exist afterwards, and having diet help or hurt in whatever case those neurological symptoms?
Yeah, no, I am just going to echo what Paula had said, that as it stands right now, when we look at evidence-based medicine for a lot of these complementary interventions, there's not much out there. Not to say that there may not be an intervention like a specific diet that could help an individual, but as it stands right now, there's not one specific diet that outshines another to say that everyone has to be on this particular diet. With that being said, though, I think eating smart is always a good thing, not only for your neurological health, but just to be healthy in general. And oftentimes, at least for my patients, given the evidence or lack of evidence that we have for specific diets, I'll mention to them that the Mediterranean style diet appears to be one of the more healthier diets one can do, because of the fruits and vegetables and fishes that are in it, low saturated fats, etc. And that particular diet, actually, if you look at other disease populations like cardiovascular disease, dementia, the Mediterranean style diet does have actually a decent amount of evidence to support that it helps influence those diseases. And since there is likely inflammation related to those conditions, then you can almost translate that into the patients that we take care of, that there may be some improvement or over the long haul with their conditions. And I think the message really that keeps coming back to me about diets and other complementary interventions is that we need to do more studies to better understand whether there are specific diets that are better than others.
Yeah. There was one specific question, wondering what you all thought of the nutritional advice given in the Walls protocol diet. And honestly, I had not heard of that before I read this question, so I was wondering if you all were aware of this Walls diet, and if you had anything to say about it in particular.
Yeah, I'm happy to start off. So Terry Walls, who is a physician, has come up with this Walls protocol and actually written a book, and what it describes is sort of her own experience and how she overcame her multiple sclerosis, which at the time was thought to be a progressive MS, and it uses sort of the paleo diet principles and other things. And I think if you look at some of the core features of that diet, they are very similar to what other diets will propose in terms of being smart about what you're eating, low saturated fats, and I know Dr. Walls, from my understanding, does have a study that's ongoing to assess her diet in more detail, but it is it has become very popular within the MS community to try it. As it stands right now, at least for the patients that I have who are on it, it may be too premature to see whether it's really helping change their, individual disease course. And again, going back to that, we need to have more studies to look at specific diets. I don't know if the other panelists have any experience with the Walls protocol or Walls diet.
I have a little bit. I've had patients inquire about following the Walls protocol diet, and I feel it's kind of the same take-home message of focusing on eating more green vegetables because we're just missing that in our typical diet. I think you're correct, Dr. Newsom, but in the fact that we don't know how this truly plays out from a inflammatory disease process. Does it really affect the inflammation that's going on, or is it simply just going to help patients just overall feel better? I do advocate for patients to eat more of the green vegetables and fruit because I look at it as though it's not going to hurt you, and it allows you to take kind of control in the management of your disease. And so anything that I think the patients can alter to give them control of in the management of their disease makes them a more powerful patient.
Moving on, there was a question saying, I'm wondering what the experts think about probiotics. I keep reading about how the microbes in a person's gut control so much. Could a lack of good gut bacteria have contributed to a person's TM, NMO, or ADEM? And could probiotic supplementation help afterwards? Maybe Dr. Newsom?
Sure. Yeah. No. This is actually a very interesting research field. There are a lot of people around the world that are exploring what we call the microbiome of disease, and specifically neuroimmunological diseases. And there's quite a bit of research that's ongoing with multiple sclerosis specifically. And as many of us know, there are billions of bacteria that live in our gut and intestines, which help balance each other out. And there's some suggestion that if there is an imbalance one way or the other with this microbiome, that it could be a portal for disease, and specifically neuroimmunological diseases. And so I think at this point there's still a lot to learn about it, and I suspect that in a given individual, their specific microbiome is going to be different than the next person, just like our immune systems are different from one person to the next. And with respect to the probiotics question itself, I have a lot of patients that are on probiotics, and whether that's going to influence their disease in the long run, I can't answer that because I think we need more studies to look at that question. But I think, as was already mentioned, probiotics, at least in my mind, don't seem to be harmful, and for some people they actually help calm some of their gastrointestinal distress that may be secondary to their disease or some other process. So I think probiotics are, at this point, reasonable to take. We'll have to see what more research tells us about the gut microbiome in general, and whether doing probiotics or other sort of gastrointestinal interventions will help mediate the disease that someone may have, and even taking it a step further, potentially folks who may be at high risk to go on to develop an autoimmune condition, maybe we can stop it in its tracks by doing an intervention like probiotics or some other intervention. And it comes up with vitamin D supplementation. That we know, at least in MS, if someone is chronically deficient in vitamin D, that puts their lifetime risk of developing multiple sclerosis threefold greater than someone who doesn't have vitamin D deficiency. So I think this keeps coming back to that there are other things that we may be able to do to prevent disease, and then if someone already has a disease, maybe to prevent the aggressiveness of it.
It sounds like from listening to you, Dr. Newsom, and Paula speaking, the importance of, regardless of your neurological diagnosis, of taking care of your health, be it diet or what have you, otherwise, to kind of help control for these some more common issues like diabetes or heart disease. Could you maybe, Paula, speak to the importance of maintaining your general health in these other ways, and how other comorbidities like diabetes or heart disease can affect any existing neurological symptoms?
Sure. I think most importantly, what we all healthcare providers need to educate our patients on is just overall good nutrition and how to take care of yourself and prevent developing other comorbidities such as diabetes, heart disease, or high blood pressure. For instance, with diabetes, I would remind my patients that it can create a peripheral neuropathy. And so the symptoms of a peripheral neuropathy are numbness and tingling. And so if you have a patient with a transverse myelitis, injury to your spinal cord, and they get concerned when they start having new numbness and tingling, and if they're also a diabetic, I have to ask the question, well, how well controlled is your blood sugar? It's going to be hard to differentiate things. Is it because of uncontrolled blood sugar, or is it because of worsening of your TM or NMO? So in that regard, it is important that for patients who have other diseases to make sure that you are taking care of those, because they will impact your TM, NMO, or ADEM. For patients who have allergy problems, for instance, you can see a little bit of worsening of your symptoms when your allergies aren't in check. And so all this different nutrition information can be vital at helping control those other disease entities also, which can affect your symptoms of TM or NMO.
Thank you. That's very, very informative. So kind of moving on, shifting gears a little bit, moving from diet to talking about more issues with physical mobility and issues of that nature like spasticity. There are a number of questions that came in that looked like people were concerned about their pharmaceuticals, the drugs that they take to control things like spasticity, that don't seem to be working, and wondering about other forms of therapy that might be able to help it. So first, there's a question about massage therapy, and is there evidence that regular massage therapy could reduce symptoms from TM or NMO? Dr. Newsom, would you like to speak to that?
Sure. What I'd like to just say first is the non-pharmacological interventions for the disability that we see that comes from transverse myelitis or other central nervous system conditions are extremely important to incorporate in patients' day-to-day or at least weekly treatment regimen. Reason being is that we all have had patients that have been very diligent with taking their medications, but then they come to our clinic stating that, well, you know, either the medications are making them very sedated, some medications can actually increase weakness, like the antispastic agents, which is counteracting all of that we're trying to do. And then there are other medications that just don't seem to impact the disease like we want it to in terms of neural repair. And so we spend a lot of time discussing what these non-pharmacological interventions can do in terms of helping people, and everyone's different. So the question is, I think, a very useful question that's specific to massage therapy. It really depends on the individual. So if someone has a significant amount of musculoskeletal strain, discomfort, spasms, like many of our TM patients do, there does seem to be a good role and a strong role for massage therapy. And in my experience, some of the deep tissue massage therapy, even though at the onset may be painful, just like physical therapy, over time it does seem to help relax muscles, relax some of the strain patterns that people develop because their ambulation is not normal any longer because of the TM event, or if they're in a wheelchair, maybe their core body strength is not there, and that's going to develop different strain patterns. So doing things like massage therapy, at least in my experience, seem to help many patients. And there are other interventions which we'll, I'm sure, talk about, but including like acupuncture, which I think has been very helpful, not only for spasticity but also pain reduction, and it gives some people an overall sense of relaxation, even though people are sticking pins in you, which is at first maybe a little bit scary, but it does seem to help a lot of people.
Yeah, it is a little counterintuitive. There was a question regarding acupuncture as an alternative therapy to help improve numbness and tingling sensations. So could you, Dr. Newsom or Paula, maybe speak to kind of the purpose of acupuncture? Why do they stick the needles in you? What's the purpose of it? And does it really help with things like the tingling and numbness and after TM?
Sure. I mean, I can start. So numbness and tingling is a tricky one. In my experience, if the numbness and tingling that patients are experiencing have a pain or discomfort quality to it, then some of the things like acupuncture seem to help more so than if it is just a numb hand or a numb foot. Although with that being said, I mean, I've had some people over time, they have had improvement in their symptoms with various interventions. To get to, acupuncture and how it works, this would be an interesting poll to take to see how people think acupuncture actually works. And to be honest with you, I'm not even sure how it exactly works. There have been some studies to look at its use in different disease states, and within those studies, it's shown sort of a mixed bag of results where patient-reported outcomes, many people seem to have improvement in a lot of their symptoms like fatigue and pain and spasticity. But as far as getting down to sort of the pathological or the I guess not pathological, but biological mechanisms of how acupuncture works, it's not necessarily totally clear to me, outside of it's likely decreasing some inflammation, maybe inflammatory cytokines. If you speak to acupuncturists, they'll talk about balancing out sort of your body, which we know in disease states there's an imbalance in many things. So I don't know if Paula has anything to add to that.
I'm kind of like, I don't truly understand, I would say, the science behind acupuncture. It's something about the placement of the needles is to kind of help create a balance in the body. I definitely agree with you on emphasizing that if a patient has more of a kind of burning in pins and needles as compared to just solely the numbness, I've had better results with the pins and needles aspect of neuropathic pain, get improvement with acupuncture compared to if it's more predominance of numbness. Numbness, I would say, is probably the hardest symptom to manage. But I do still recommend it for my patients with severe burning and tingling, and I would say probably about 50% of them report some type of relief. I would advocate in Texas, we now have acupuncturists have to be licensed. So I would encourage each patient to kind of look into their state's laws to see what is done about the licensing of acupuncturists. And so I always encourage my patients to seek out one who has taken the extra steps to be licensed with the state of Texas.
Yeah, that's good advice. There were a couple questions that came up asking about alpha-lipoic acid supplementation to help with nerve damage and the tingling in pins and needles feeling. Dr. Newsom, is there any kind of evidence to say that could be helpful in this kind of issue?
So there are some studies out there looking at this agent, and probably the best studies, at least in my mind, are looking at diabetic neuropathy, so peripheral nerve disease, and showing that there seems to be improvement in patients' discomfort related to the neuropathy. As it relates to central nervous system damage, it's a little more difficult because, to my knowledge, there haven't really been well-designed placebo-controlled studies to look at lipoic acid. With that being said, though, I have had patients that have taken it, just like patients taking L-carnitine or biotin, coenzyme Q10, and for some patients, they feel that these supplements do seem to mitigate some of their symptoms, and even though it's not being shown in a study, doesn't mean that it doesn't work, right? And so I think getting back to what many of us have said already is that some of these supplements don't seem to be harmful even at larger doses. The body most often with some of these supplements will just get rid of it through the urine if it's not needed, and it won't accumulate within the body. There is some data out there, more in the peripheral nerve world for lipoic acid, but like I said, I've had some patients take it, and it seems to help them.
Thank you, Dr. Newsom. There is a question that came in. I'll direct this to Paula. Does water therapy or floating therapy work to help manage some TM symptoms?
I guess it depends on what symptoms the question was referring to. I know I do recommend water therapy to help with the retraining of the gait after an acute TM, and that's just part of just overall just the exercise component for my patients to do. So if they do have some gait abnormalities, being in the water is kind of a safer option. It's harder to hurt yourself if you were to fall or something. And then being in the water allows for you to get some resistance training done also as part of doing your cardio. And so it's also important for TM patients to build muscles, but sometimes depending on what muscle group has been affected, you can't do that with conventional weight training. And so being in a water can allow for the cardio aspect and to get resistance training to work on strengthening your larger muscle groups in your legs and everything.
Okay. Thank you, Paula. There were a couple questions that came in regarding e-stim treatment for muscle activation as an alternative therapy. And Dr. Newsom, would you care to speak to the concept of e-stim, what it is, and is there any evidence as to its effectiveness in TM and NMO in these diseases?
Sure. So I think this is becoming more popular, which I'm glad about because electrical stimulation has been around for quite a long time. It's been primarily used in sort of the spinal cord trauma world, post-stroke world, but now is starting to be utilized in the neuroimmunological world. I'm somewhat biased because of my experience here at Hopkins and Kennedy Krieger with our TM patients, MS patients alike. We'll try to get them engaged in an aggressive rehabilitation program, not only in the acute phase of their attacks, but also in the subacute to chronic phase. And so functional electrical stimulation ends up being a part of most of the patients' rehabilitative programs. And, just to give you an example, so if someone is weak from their transverse myelitis attack and they're not able to pick their legs up against gravity, there are these electric stim techniques that can be done to help stimulate the muscles that are weak in order to get them active and move in a more normal fashion. For example, there's a functional electrical stim ergometry bike that people can use where electric pads are put on the great muscles in the thigh, hips, and buttock region, which sends electrical pulses to the muscles to activate, and that helps someone do the cycling motion that they're not able to do because of their weakness. And if you look at what's happening in those situations, and you can apply this to anywhere in the body that electrical stim is being given to a muscle, what we think is happening is that is, for central nervous system conditions, sending positive feedback to the central nervous system because of the different reflex loops that are present with the nerves and the muscles. And there are some small studies and preliminary data that's showing that electrical stim may in fact actually help with decreasing inflammatory cytokines, which we know is a large component of neuroimmunological disorders, especially TM and MS and NMO. And there is some data to support that growth factors and neural repair markers may be induced and increased when you have electrical stim applied over time, which is very encouraging. And so I think part of these small studies showing these biomarkers changing within the spinal fluid is setting a precedent to move forward with using electric stim in neuroimmunological disorders more so. And we're actually doing a study here at Hopkins evaluating this in progressive MS to see if E-stim versus non-stim ergometry, if there's any difference between the two. And so I think it's very exciting because, again, going back to the medications are good, but they do have their limitations. And electric stim in general, at least if we think about the bike E-stim, that has more widespread effects than just the nervous system. So if we look at very nice studies done in the spinal cord trauma world, there's a lot of cardiovascular benefits. There's a lot of bone health benefits, decreasing osteoporosis. And so it seems to maintain and help people's just overall general health. So I'm a big advocate for E-stim.
Great. Thank you for that great explanation of what E-stim is and how it's working. We have a live question that came in from Facebook. I'm going to direct this toward Paula because I know that she loves it when I do this to her. There's a question that came in asking about fatigue after TM, and are there different things that one can do, alternative or otherwise, to help manage symptoms of fatigue after these kinds of diseases?
Sure. So the first thing when I hear the words fatigue in any patient is I want to get a good sleep history. Are there things that are going on during the sleep that can further exacerbate a person's fatigue? Are they getting a good 7 to 8 hours of sleep most nights? Or do you have issues with pain at night that are interfering with sleep? Or is there bladder issues? Is the patient having to get up every couple hours to go to the bathroom, and that's the reason why they're not getting good sleep, thus causing them to have daytime fatigue? Do they have a spouse that's snoring and it's keeping them up, or do they sleep with their pets in their bed? Or so to really evaluate what's going on when they're sleeping. If those things have been corrected and there's still an issue with fatigue, then exercising, just being active, can help reduce the fatigue symptoms. So I always encourage my patients to do 3 to 4 days of physical activity, about 30 to 45 minutes a day, and to try to tailor it specific to what their abilities are. So for people who have gait problems, I tell them just to get on a recumbent bike. Stationary bike can help with exercising and give you energy. There are supplements that you can take There's the old good one, vitamin B12 can still help with energy. And then a lot of times in our patients we'll use acetyl L-carnitine as a supplement that can be bought over the counter that can help with energy. And then if it's really bad, there are prescription options of medications that we can use to help with fatigue. But I try not to go that route and really look at a person's lifestyle to see are there other variable factors that could be affecting their daytime fatigue.
Thank you. Dr. Newsom, do you have anything to add to that?
No, I think that was perfect. I do the same thing. I tend to not blame all symptoms that someone has on their pre-existing diagnosis, whether it's transverse myelitis or MS, and because if you do that, then you may end up missing something that needs more urgent evaluation. For example, I'll just give a quick scenario. One of my MS patients who never really had fatigue issues developed pretty profound fatigue, called me, and it was during the summertime, so a lot of patients with MS, TM, and other like disorders will have heat sensitivity, and it can develop over time. And so initially, the thought was, well, maybe it's just, there's a change, and maybe she's developing heat sensitivity, but it would be worthwhile to, ask her the questions, just like Paula emphasized, how is her sleep? Are there any new stressors? Is there a change in her day-to-day? And then to get some basic blood work just to make sure there's not a superimposed thyroid, disease, B12 deficiency. And lo and behold, she was severely anemic, and so much so that it required a transfusion. And interestingly, once this was worked up a little bit further, she had a peptic ulcer that was slowly bleeding, and not to the extent where she would have noticed it, in her bowel movements per se, and she wasn't having a lot of gastrointestinal distress, but that was enough over time to cause severe anemia, which then translated into severe fatigue. So I think it's always a good rule of thumb to not just necessarily blame everything on the pre-existing diagnosis that someone has, and to look a little bit further, and if you've ruled out sort of the common and more uncommon things, then start going down the line of supplement or other pharmaceutical interventions. There are stimulants that can be used in addition to sort of the supplements.
Thank you for all of that. We're going to shift gears again now and incorporate Catherine a little bit more. We don't want to leave her out. There were a few questions that came in regarding more of work-life balance issues. And the first one that I'd like to speak to is a question regarding claiming disability. And so the question is, since all work is exhausting with TM, when is it time to make PT and personal pursuits a priority over employment by claiming full disability? And so, Catherine, if you could speak to kind of what it means to go on official disability, and if you have any recommendations about what patients should think about as they pursue something like that.
Okay, thanks, Sam. This is a great question, and in our clinic, it's really considered on a case-by-case basis. And we're not actually the ones making the decision if someone's disabled or not. We just provide the facts, and then the policy or Social Security disability is doing the review. If someone is having a lot of problems, we really encourage them to come into clinic so we can meet with them and just discuss what's going on and come up with a plan to try to alleviate some of those symptoms. And so sometimes people do need to take a short-term disability leave. And they can either do that through their family medical leave if they have the benefits, which most people do. And you could either take intermittent leave or you could take a block of leave to work on your health or work on alleviating those symptoms and decreasing those. And then some people do have short-term disability benefits. And I think it's important for people to know what are their benefits, even if they're not thinking about going out on disability. Do I have short-term disability? Do I have long-term disability? Because some employers do provide that. And we also want to advocate for accommodations for that person. And there's a really good resource that's available to our patients to anybody, it's the Job Accommodation Network, and people can get some really good ideas on things that might help them to keep working. And usually each state has their own vocational rehab programs. And these are free services to our patients, and they can work on accommodations, and then we're, of course, happy to write those letters or advocate for them in whatever way we can, or work with that vocational rehab program to try to keep people working. Because in general, we really try to support people to keep working as long as they can. But if there is a time none of these things are working, they're getting bad reviews at work, and they just can't continue, and you've done all these things, we really like to get all that medical documentation in the chart. Because if you're applying for Social Security disability, which is your government benefits, they're looking at your work history, and you do have to have a certain amount of work quarters behind you to qualify for Social Security disability. But things to consider is this is going to be a fraction of your current salary, the Social Security disability, and also you need to think about medical insurance. Can you get on your spouse's insurance in the meantime? Because Medicare will not kick in for 2 years with Social Security disability. And then there's also SSI, Supplemental Security Income, and that's for people who are disabled and can't work and have low income. So that's another option, and then people usually will get Medicaid with SSI. But both, and with long-term disability policies with your employer, we really need that documentation in the chart, because that's what they're reviewing to look at, is this person disabled, and are they going to be disabled for a year or longer? So that's why sometimes just a short disability leave or just taking some intermittent leave for yourself to do counseling or physical therapy or whatever it is that you need to do to try to help you.
Well, it sounds like there are a lot of different options for taking leave and disability, but it sounds like it's pretty important that if you're thinking about moving in that direction or looking at your options, to include your healthcare team about those options and what you're thinking, to make sure that everything's kind of set in place. Would you agree with that, Catherine?
Yeah, I definitely agree with that, because if we haven't seen you in clinic in a year and you've applied and we don't even know, who knows what's was in your chart a year ago, and we may not know the current issues that you're having, and we want to try to help you with them so that you can keep working if possible. But then the people who, if you are not able to continue working, I always tell people, don't feel bad about it. Don't feel guilty. They're your benefits, and it's your right to work on those benefits. But sometimes it can be a difficult process. If people aren't approved the first time, then they're looking at appeals, and it can just be a really long process. But some people do end up doing a lot better once they've quit working, if it's really, they have no quality of life outside of their work.
That kind of moves into another question, and Catherine, I'll let you speak to it first, but Paula and Dr. Newsom, feel free to chime in. There was kind of some thought in there about how a patient's symptoms after years of a diagnosis are seeming to inhibit them from living a regular life because of cramps and things like that, and that more active lifestyle seems to aggravate those symptoms, and there's a fear that they're becoming more reclusive. And so I was wanting to kind of ask the question on their behalf, are there any kind of support groups or places that one can go if they're starting to feel reclusive because of issues with their disease, if they don't have a lot of close family or friend support, to make those relationships and to kind of help prevent that reclusiveness from happening? Do you have any, Catherine, do you have any initial thoughts on that?
Well, I think maintaining a good balance is really important, and I wanted to touch on that just a little bit, but it is really important to stay engaged in activities and with your support network in any way that you can. And there are opportunities, I think, in every state. It's just a matter of finding them. Usually you can call 211 in your area, and they can tell you about local resources. Like in Texas, we have this great thing called RISE, and it's adaptive sports for people that do have some impairment. And some of our patients that have attended these just love it. They do all kinds of things. I mean, they go fishing, they go water skiing, all kinds of different things. But I think it's really important to attend to your emotional health too, because if you're isolated or you're just having really intense stress, that can really take a toll on your health, and then compounded by having transverse myelitis or any other illness. Okay? Because some of the things that can come about with that is feeling really down or overwhelmed or having trouble making decisions, the sleep disruption, having headaches, and worrying. So one of the things as far as maintaining balance, which I had come across as well, I think this would be a really good exercise for people to do, is to keep a log for a week of all the activities that you're doing, and then look at that and rate them in importance, like what's the most important, least important, or middle importance, or something that's just a total waste of your time, and then highlight those things that you really want to do more of. And I think when we're faced with a challenge or some life-changing event, it also gives us time to stop and assess what is really important in my life, and what things do I really want to do more of. And then as far as relaxation skills, I kind of wanted to talk a little bit about breathing, because I think that's really the fastest and easiest route that people can get to relaxation, and anybody can do this. And it really helps people bring control of they're bringing an inner calmness to themselves. And I think a lot of people forget how to breathe in a relaxed manner because we have learned to live with all this enormous tension on us. And it's just a gift that people can give to themselves anytime, anywhere. Like if I'm driving in my car, I have a little lavender pouch that I keep there to remind myself when I'm stuck in traffic and getting really stressed out, I'll smell my lavender and do some deep breathing. And also at work, I have a stone that I'll rub to remind me to do deep breathing as well. And it's also a part of two of my other favorite skills, learning relaxation, is yoga, where you also get a lot of stretching and there's a lot of attention to breath. And then also guided imagery I love, where you can use your own imagination and senses to bring about calmness and helping your mind and body heal and help you keep strong. And also I think self-compassion is really important. If you're down and feeling, we can't all do everything right. And there is a website you can go to test your self-compassion, and also exercises to do. I feel like people really need to be kind and good to themselves because they're living with a lot of challenges that other people don't face. And they can look that up. But just easy things like talking with friends and family, but realizing that they have to adjust as well to what's going on. Music, art, prayer, just going outside can be really helpful. And I think it's just each individual finding out what works for them to relax themselves. And I really encourage everybody listening to do some kind of relaxation exercise each day, even if it's just 10 to 15 minutes a day. And if you're having problems figuring out what's good for you, maybe even seeking out to see a counselor or a psychologist on just management and learning more relaxation skills that maybe work for you.
That's very helpful, Catherine. It sounds like when we're trying to find that thing that relaxes us, it might take a little bit of work up front to really find out what that is and make it a habitual thing. But once you can find that thing and take your 10 minutes a day of quiet time or whatever it is, that can really have some profound effects on you long term. Would you agree?
I agree, and I think if you practice it, practice makes perfect, and like with guided imagery, if you practice it, it can really help lower your reaction to stressful events in the future. And you can bring some of those involuntary responses under control, like your heart rate and your breathing.
In terms of guided imagery, quickly, would you kind of explain quickly what that precisely means, or where can they do it by themselves, or where do they go to learn this?
Yeah, they sure can. There is so many websites out there where you can get imagery. One of my favorites is Staying Well with Guided Imagery. It has a lot of different imagery for all different reasons, but basically you can do it anywhere. Anyone can do it. You're using your own imagination and your own senses to bring about the relaxation response. And this book, it's by Belarus Naparstek. You can find a guide for you. There's also Miriam Franco Emmett Miller. I mean, if you Google it, there are so many options out there to do guided imagery, and a lot of free options as well. So, or not very expensive. So it's something real easy I think people can do for relaxation.
And I think Catherine brought up a great point with the relaxation, the body's response to it. Patients have to keep in mind when we get ourselves in these little stressful situations that come up day in and day out, what that does is it puts tension on your muscles, and so therefore you're making your spasticity worse, and in return your spasticity is worse, and now you have more pain, and then that could be the reason why you're not sleeping comfortably. So it is very important for all of us to realize what can set us off to that point, and so what I can do about it is I can change how I respond to it. I can't control a person running into my car, but I can control how I respond to that situation. And so if it means taking 30 seconds and just doing deep breathing to calm myself down so I don't have the negative aspects of what stress and anxiety can cause to the body.
That's valuable. So as we're kind of moving into the last couple minutes of the podcast, I was hoping that maybe starting with Dr. Newsom, if you want to give some final words, final thoughts on the whole conversation that we've had today, and if there's any final takeaway that you'd like for our listeners to have.
Yeah, absolutely. So I'd like to first mention that complementary medicine and non-pharmacological interventions, in my view, are key in treating patients with central nervous system conditions, and it really, in my mind, it helps bring an extra element to the multidisciplinary approach that we try to treat our patients with, and that there are not a lot of studies to support some of the complementary medicine interventions that will endorse or recommend to patients. However, that doesn't necessarily mean that they don't help on a given individual. And for a lot of these different therapies, especially the ones that don't seem to cause any harm or distress to a patient and appear safe, they're worth trying, within reason, and that it always just helps me refocus that there's much more research that needs to be done with a lot of these sort of non-Western interventions, including acupuncture, some of the supplements that were mentioned today, and then also looking more in depth to some things like the gut microbiome. And so I'm a big fan of non-pharmacological interventions, and I think for each individual, if one particular intervention doesn't work down the complementary medicine path, that doesn't mean that all of them will not work for an individual. You just have to keep trying and seeing what may help you. And so I'll leave it at that.
Thank you, Dr. Newsom. And Paula and Catherine, any final thoughts, final words?
No, I think Dr. Newsom said it perfectly. With medicine, whether it be for the traditional pharmaceutical drugs or complementary and alternative medicine, it has to be an individualized approach. So what may work for your friend or neighbor may not work for you, but it doesn't necessarily mean that it's bad. And so we just all have to keep going and looking to find different options to help each of us as an individual.
Yeah, thank you. And Catherine, final thoughts?
Yeah, I think just to add the same thing, just as far as relaxation skills, finding what does relax you and trying to incorporate that into your day to help you maintain balance and learn to say no politely when you need to, and assessing what you can take on. And then also, if you are thinking about applying for disability, to really work with your healthcare provider to see if there's anything that can be done first to keep you working, and if not, to get the documentation into your chart to help help with your application.
Thank you to all three of you for your willingness and to come speak to the listeners today and for your expertise. There were a number of questions that came in that we couldn't get to today, unfortunately, that seem to do with a lot of symptomatic issues and questions about how different symptoms following TM and NMO occur, and that might lead to a whole other podcast. But thank you to our listeners for listening, for coming in today, and for your questions. I hope everybody has a great week, and we look forward to your questions in the next podcast. Thanks again to our experts, and we'll see you next time.
Thank you.
Thank you.